Good afternoon, everybody. How you doing? I'm just Aaron right here, Canadian Loonie. We've got a pretty interesting live review here. We're going to be checking out ARA SAKS. She's our Minister of Mental Health and Addictions. She comes off very often as being incompetent in outer space, but we've got lots to show here. We're going to look at a couple of pieces from our friends at Rebel News. We are going to. She's our Minister of. There we go. So we're going to jump into the intro and let the story be told. ARA SAKS is the Minister of Mental Health and Addictions, and it's quite appropriate, I guess. Everyone has an opinion about Canadian federal politics.
Oh, yeah.
Hey, everyone, quiet down. There's a bulletin on TV.
And now for this news flash.
It's time for a change in this country, my friends. A real change.
So you want to vote for a pretty boy Canadian named Justin. What could possibly go wrong?
When I'm Prime Minister, I will keep my promises.
When will we put an end to this wacko policy by this wacko Prime Minister?
No. We see proof that the Conservatives simply don't understand that low-income families don't benefit from tax breaks because they don't pay taxes.
Mr. Speaker, the leader opposite is showing us exactly what shameful, spineless leadership looks like. If anyone feels that they were impacted by my actions, I completely apologize. It's not my intention to hurt anyone.
Wiggle and squirm as you might, it is really hard to put lipstick on a pig.
And I dressed up in an Aladdin costume and put makeup on. I shouldn't have done that.
WTF.
Hear, hear. It's time for a change in this country, my friends. A real change.
I made a mistake, and I'm sincerely sorry.
I think our leader, Trudeau, I don't think I've ever heard him say a true word.
Oh, yeah.
Ezra Levant here for Rebel News. I am in a mall, a nondescript mall, where ARA SAKS, perhaps the second stupidest cabinet minister in Trudeau's cabinet, had an event. And can you believe it? She invited me. What are the odds? So I accepted the invitation immediately to come, and so did my colleague David Menzies and others. And we were on our way here this morning when we got the rudest email saying that the media invitation that we had received and answered and were confirmed, that the whole thing was canceled. Well, that doesn't sound very friendly. It's sort of like being invited to someone's Christmas party and then later being disinvited. That's downright rude. Not the sort of thing you'd expect from a cabinet minister who met with Mahmoud Abbas, the arch-terrorist leader. I guess what I mean by that is she's more scared of Rebel News asking her questions than she is of a terrorist leader. We were parked outside here for about half an hour, and we had my colleague, David Menzies and Lincoln Jay outside, but she pulled up in a little red Mini and she's sneaking in a door and the door slammed shut behind her. Here, take a look at the footage captured by my colleague, Lincoln Jay.
Sneaky.
She's a sneaky one, that ARA SAKS, but in some ways I can't blame her. When she allowed herself to be scrutinized, not by the media, but by her own citizens, her own voters, a few weeks ago at the Pride of Israel town hall meeting, she was roundly booed and heckled. It was astonishing. I think there were about 400 or 500 people there, and half of them were shouting her down. Remember this?
Please. Join me in welcoming ARA SAKS to share her thoughts. Once again, I'm asking you to rise above it, put your signs down, or leave the room.
Ooh, so that's her own voters. But just a couple of days ago, she went to, some picnic. And the other side, the pro-Hamas types, heard about her. And she got it from both sides. Did you see this footage just from a couple days ago?
You continue to remain silent. You have the opportunity to agree to meet with your representatives and constituents who are concerned about your silence and complicity in this genocide. Your hands! Blood on your hands! Blood on your hands! Blood on your hands! Blood on your hands! For 10 months, Sarah. 10 months you've been calling, emailing, showing up at your office. The members of the York Center community have been calling, emailing, and showing up to her office daily.
Yeah, it's tough being ARA SAKS. It's tough being a liberal in Canada these days because, especially on foreign affairs, they'll say different things to different audiences. What I mean by that is ARA SAKS will pretend to the Jewish community that she's in solidarity with them, but then pretend when she's with the liberal Hamas caucus that she's in solidarity with Gaza. You can't really have it both ways. ARA SAKS has some very specific questions, though, that she refused to answer. Remember a few weeks ago when my buddy David Menzies was granted accreditation to another event she had? It did not go well for ARA SAKS. Take a look.
Good morning. David Menzies with Rebel News. My question is for Minister SAKS. Why did you travel to the Middle East to shake hands with Mahmoud Abbas, a terrorist who runs a pay-for-slay scheme?
Okay, so we're just going to be doing questions just strictly related to today's announcement.
I think this is a more important issue, given the state of the world, than what's happening now. And the minister has avoided these questions. Also, Minister, do you think it's a good idea that your government is planning on bringing thousands of Gazans into our country? These are people even Arab Middle East nations won't take in. Given what we've seen in the streets of Canada for the last 8 months of people chanting for genocide, surely you, as a Canadian Israeli Jew, you should have some skin in the game. What do you say to this decision? Well, I'm waiting your answer.
I know, we appreciate you're allowed to state your question, but I think that, I don't know if there's going to be a response today, but we really appreciate you coming.
Ms. SAKS, I again ask you, why did you go to the Middle East to shake hands with a terrorist, especially post-October 7th? Why were you even in the Middle East? You're not the Prime Minister. You're not the Foreign Affairs Minister. Ms. SAKS, your government invoked the Emergencies Act to shut down a peaceful protest. In Ottawa, you froze bank accounts of Canadians. We have chants of genocide and violence in the streets of Canada. Why aren't you doing anything about that?
Let me emphasize something about what David did there, is that his questions were put politely. David's a polite person by nature. He always says miss or ma'am. He doesn't swear. He doesn't get physical in any way. He just does old school journalism. It's so rare to see it. We are sometimes startled by it. David Menzies asked real questions, and ARA SAKS is incapable of answering them. Did you see her sneak in the back like some sort of fugitive? It was actually quite undignified and beneath the station of a cabinet minister. I should tell you, if she was scooting around outside, she must have seen our glorious truck with the firesaks.com billboard action on it. You know, of course, it's always going to be possible for a sneaky liberal to sneak into a building and sneak out if they're dedicated enough to it. And I admit that she got biased, although Lincoln spotted her. But I don't think that's a way to be a political candidate. I mean, you're basically acknowledging that the public hates you, but I don't think that's the way to be a cabinet minister either. Some of the folks from the Social Services Agency behind me were a little bit frustrated that our being here caused the minister to delay as she circled around to sneak in. And I absolutely sympathize with them for this reason. A grown-up, a responsible adult who is ready for the burdens of being a cabinet minister should have the mental, physical, and courage abilities to take a question or two, even from critical media. What I mean by that is, you saw David's questions. They must have an answer. She must have thought about the answers. Ministers have legions of staff briefing them every day about what the issues of the day are and giving suggested lines. She's not a private person. She's a public person, a powerful person, and part of her job as cabinet minister is to answer legitimate questions from the public. That's my way of saying that if she were more courageous, if she were more worthy of the position she's been entrusted with, she would have walked right in these doors, heard a question or two from me or David Menzies, answered them without whatever answer she has, and walked right in to continue her event. But I think she lacks the moral fiber to be able to do that. She lacks the confidence in her own position. I think she genuinely is the kind of politician who will read whatever is put in front of her. I have a tiny bit of sympathy for her because it's so pitiful to watch. When she was booed in her own community, for a second it sounded like she was going to cry. But there's no crying when you're in the cabinet. Your job is to be on par with the other cabinet ministers, to go toe-to-toe with people around the world. What I think she demonstrated is that she will spend more time with a terrorist like Mahmoud Abbas. She will show more courtesy to a terrorist like Mahmoud Abbas than she will to her own citizens. I'm a voter in her riding, by the way. Or legitimate journalistic questions such as those put by my colleague, David. Now, I actually don't want to bring any discredit to this worthy social services agency behind me. And they're not the reason we're here. We're here because ARA SAKS invited us to be here. And then when she saw our names RSVPing, she canceled in a panic. I am looking forward to the voters of York Centre indeed firing ARA SAKS.
All right, gang, so now we're going to take a peek at David Menzies' version of a very similar story about ARA SAKS. It's a lot, man. It's a lot to watch. Hey, Stephen Bloy, what's up? How are you? Let's get right back into this.
David Menzies for Rebel News here in North Toronto. And folks, I'm standing outside a building that houses the Toronto Community Benefits Network. And ARA SAKS, the MP for York Centre, she's to drop by here. Well, she was planning to drop by here and have a press conference. And myself and Lincoln J. and my boss, Ezra Levent, we all applied for media credentials and we received them. And then just minutes before the press conference was to take place, we were informed that it wasn't going to take place. Kinda. You see, ARA SAKS, she was late and she didn't walk in the front door. She snuck in. Let's throw back to the footage from some almost 3 hours ago when my boss, Ezra, was trying to get ARA SAKS on the record.
What's up, Ray Man?
Sneaky.
Well, folks, about an hour and a half ago, my boss, Ezra Levent, he had to hustle back to the office for some important business. So my cameraman, Lincoln J. and I, we stayed behind to catch ARA SAKS and ask her some questions. But wouldn't you know it, she once again snuck out. This time, we were not fortunate enough to catch her. But what does that say? I mean, this is supposed to be a parliamentarian. Why don't you just face the music? Yeah, maybe our questions are impolite, maybe they're insensitive, but you should have a backbone. You should have the intestinal fortitude to take these kind of questions from the media. Yeah, I know ARA SAKS, she's probably used to softballs from the CBC and whatnot. But we want to ask real questions. And what questions would they be? Well, as our truck was demonstrating, what was the reason for ARA SAKS going to Ramallah and shaking hands with Mahmoud Abbas? This is a guy that runs a pay-for-slay operation, i.e., kill an Israeli, you're going to get a check. If you die trying, no problem, your family gets paid out. And of all people to get cuddly
Tinfoil hat, how are you today?
with this
What's up,
terrorist,
SW?
a Canadian Israeli Jewish woman? Are you kidding me? And especially since she's not the Prime Minister, she's not the Foreign Affairs Minister. What in blue hell was she doing there in the first place? Another question, and it pertains to this disastrous press conference that was quasi-cancelled. I mean, they said it was cancelled, but, you know, they snuck ARA SAKS in. Is this how you're going to play out the remainder of your term? You're going to be acting like some scared little mouse, just afraid of the independent press, the glare of the camera, the sound of insensitive questions? That is pathetic. And another thing I wanted to ask her, remember her most infamous statement, I think, in the House of Commons, that honk honk is an acronym for Heil Hitler. Do you remember that? Let's throw to a clip of ARA SAKS in action.
Honk honk, which is an acronym for Hail Hitler.
Well, first of all, Ms. SAKS, I want to educate you. A sonic outburst is not an acronym. An acronym is a combination of individual letters that spell out a word, you know, like NASA. So you don't even know what an acronym is, but where did you get that information? I mean, your government seems obsessed with misinformation and disinformation, and somehow you came up with the crackpot idea that a car honking its horn twice is Heil Hitler. Please don't go downtown during rush hour. You will see Nazis galore on the streets of Hogtown, let me tell you. But in any event, folks, we did give it the good old college try. We wanted to pose these questions and others to ARA SAKS. But ARA SAKS, at the end of the day, and I don't care where you sit in the political spectrum, ARA SAKS is a coward. She is a scaredy cat that will not face the music. Let me ask you, if you live in York Centre, is this who you want to be your Member of Parliament? For Rebel News, I'm David the Menzoid Menzies.
Hey, Kenzie, how are you doing?
Yeah, I know there's plenty to choose from, folks, but is ARA SAKS perhaps the most despicable Liberal MP in government today? I think so. I think she actually meets the benchmark of a self-hating Jew. How else can you describe why she would go to the Middle East and shake hands with a terrorist who denies the Holocaust while he tries to manufacture another? If you feel like we do, please go to our petition, firesaks.com. That's firesaks.com. And if you're able to, kindly make a donation so that Rebel News can continue to bring you the other side of the story.
We're going to start with questions now. Begin.
All right, guys. To give a little explanation, what we're going to be watching now is from the committee, health and safety. So, ARA SAKS is going to be testifying here, and Dr. Stephen Ellis is the most entertaining part of this piece. What do you guys think, before we jump into that, about the Rebel News van? I love that van too, and they are bold and brave. They do not hold back or pull any punches at all. Big fan of Ezra and the Menzoid. They're great. Anyway, we're gonna jump into this committee video. Let's get it going.
With the Conservatives for 6 minutes, Dr. Ellis, please.
Thanks, Chair, and thanks, Minister, for being here. You know, one of the things we say in medicine is primum non nocere, above all, do no harm. Perhaps you could table, actually not perhaps, we'd like you to table the data from which your government draws its information to tell us and Canadians when you're going to end this dangerous experiment.
I thank the member for his question. As he's aware, and I'm happy to table here, all data of our programs and the evidence that we have collected from our SUAP projects and other interventions are available on our website. We're happy to table them here. I'm not really sure what you're referring to in terms of an experiment. If the colleague could clarify, please.
Thanks very much, Minister. I appreciate that, because those were the words of Dr. Hanley, that this is an experiment. That's the original motion here, that
What's
the
up, Canada?
decriminalization
Good
of
to
drugs
see
that
you.
you're doing hand in glove with BC and the so-called safer supply is an experiment. So could you actually table with this committee the official government data to show that the so-called safe supply saves lives?
So the BC dashboard is available with all of the evidence collected today within the first year of the pilot. We're actually coming to the first year anniversary since the BC government requested the exemption on decriminalization of personal possession. All of that data is available and we're happy to table it. However, as the colleague well knows, this is a 3-year pilot program.
Clearly, Minister, we know that the number of deaths every day is going up, now stands at about 22 across our great country. When will you end this dangerous experiment?
The question is, how will we continue to save lives? That is my answer to when we will.
I'm sorry,
we
Minister.
will not stop providing
but I'm going to
healthcare.
interrupt you there, because my question was, 22 people are dying every day. That's increasing. Everybody here knows it. Everybody across the country knows it. That is getting worse. When will you decide to end the dangerous experiment?
My answer will be that we will never stop providing medical health care services and interventions to those who use drugs and substances. Every life loss is one too many.
Excuse me, are you suggesting that the so-called safe supply is a medically necessary and a medically proven therapy?
Suggesting that the entire comprehensive approach of a continuum of care, which includes a wide range of medical health services and interventions, is something that we are fully committed to save lives in this country.
So, Minister, I guess what I hear you saying, and correct me if I'm wrong, but is there any evidence that could possibly exist that would make you end your dangerous experiment? Even though the numbers are getting worse every year, you're not stopping it. You're telling us it's going to go on for 3 years. Is there anything that's going to make you stop the dangerous experiment? You're harming people.
The reality today is that the illegal toxic drug supply is pervasive and deadly, and I do not see any government stopping in its efforts to save lives from what is such a dangerous and pervasive illegal distribution of drugs across this country.
Minister, even though you know it's harming people from the studies that are out there, science, that you're going to continue that harm. That's what you're telling Canadians.
Evidence of overdoses today shows that the majority of overdose deaths are from the illegal toxic drug supply, and we will continue to fight and save lives.
Minister,
Hi,
this little
Cicely, how are you?
demonstration,
Good to see
we
you.
talked about decriminalization. This is not drugs. This is actually sugar. This is 2.5 grams. Realistically, the density is about the same as fentanyl. For Canadians out there to understand that this is 2.5 grams. And we also know very
Point of
clearly
order.
that from...
Point of order.
Ms. Atwin, on a point of order.
Thank you, Mr. Chair. I'm just wondering about the use of props in committees. If you could rule on that, please.
Okay.
It is not.
Okay. I'm advised that the rules regarding the prohibition of props also apply to committee, so I would ask you to refrain from that, Dr. Ellis. Thank you.
Well, I certainly would like to challenge the chair on that, Chair. I mean, this is absolutely ridiculous. We know that from many other committees, props are more than happy to be allowed in every other committee. I've been at Natural Resource, National Defense last night, Natural Resources early on in the week this week. Props were used, and this is an absolute travesty. We know that simple allowance to use props in committee has been something that has happened across a multitude of committees, many that I've just named, and your ruling, sir, is absolutely incorrect.
Well, so it's a non-debatable motion, a challenge of the chair, so the question for the committee is whether the ruling of the chair shall be sustained. So the ruling that I made was that we are not going to allow props today, or ever.
Or ever.
Please conduct a vote, Madam Clerk.
So silly.
Ms. Atwin? Sustain. Mr. Hanley?
Sustain.
Mr. Juari?
Sustain.
Mr. Pulowski?
Sustain.
Ms. Sidhu?
Sustain. Mr. Ellis,
Against.
Mr. Kitchen,
Against.
Ms. Goodridge,
Against.
Mr. Majumdar,
Against.
Madame Larouche,
Pour.
Mr. Johns.
Sustain.
Seven yeas, 4 nays.
The ruling of the chair is sustained. Dr. Ellis, you have 2 minutes and 18
Point of order.
seconds. Point of order from Dr. Kitchen.
Point of order. Mr. Chair, can you provide for this committee the actual ruling of your ruling, exactly showing us where it says in the books and in the orders that that's exactly for committees, please?
Dr. Ellis, 2 minutes and 18 seconds.
Well, thank you, Chair. You know what? And it's interesting that during this committee, we know very clearly that from the Canada.ca website, a few grains can kill you. And we know that that's true. And that would be simply a small amount of sugar if there happened to be any on my desk. A very tiny amount. And I guess the question is, do you think that that is appropriate, Minister, that now we're going to prescribe that to children?
I believe the colleague's question was also asked during a previous committee meeting to one of the officials, and what I'll say is that the decriminalization pilot is, first of all, anchored in reducing the level of stigma of those who use drugs to ensure that they get to treatment and access and care.
It is giving giving very potent opioids to children, of which the Canada.ca website says very clearly a few grains can kill you. Is that appropriate?
So, Mr. Chair, my colleague did ask this question before, and I believe we've already tabled all the proofs on safer supply, and I'll be happy to table them again for further reference.
That's not the question, Minister. My question is do you think you should be giving an incredibly potent synthetic opioid, of which a few grains can kill you, to children? Yes or no? Simple.
Each physician works with their patient on the treatment protocols that work best for them. That is a very unique and important relationship that
Thank you
every
very much,
patient should
Minister. I
have.
appreciate that. Doctor-prescribed opioids are being sold on the streets. A Global News reporter was able to buy 26 tablets of hydromorphone in East Vancouver from the so-called government, taxpayer-funded safe supply. Total price $30, about $1 a pill. When you saw that report, what did you do, Minister?
I'm aware of the concerns about diversion. I've said it in this committee before, and I will say it again. Diversion is illegal.
Action did you take? What did you do?
I'm happy to answer, Chair, if I'm not interrupted.
Yes,
Thank you.
please go ahead.
Since I'm aware of the physician's letter, I've actually met with the expert physicians who submitted the letter to me, and we also conducted a roundtable discussion with them, with department officials on January 30th, and we continue to consult with them on ensuring that we safeguard prescriber interventions that are safe.
So, Minister, what I heard you say is you had a couple of meetings and actually did nothing about it. Well done.
That's the last question. Go ahead and answer it, and then we're going to move on.
In addressing the toxic illegal drug supply, to my colleague, I say that we need to use every resource and tool we have available to us and continue to consult with experts, including those who have concerns about prescriber models. Thank you, Chair.
Thank you, Minister. Next, we're going to go to Ms. Atwin, please, for 6 minutes.
Thank you, Mr. Chair, and thank you, Minister, for being with us and this incredible panel of department officials as well. And this is certainly a critical discussion for Canadians. And I'll just pick up on the last piece there of questioning around diversion. I know it's a important topic that we'd like to address. And I think nobody would be surprised to know that, of course, diversion is illegal, and it's an issue that applies to all prescription drugs in Canada. And it's, we have many doctors around the table that I'm sure make tough clinical decisions in their practice, balancing benefits and risks of intervention. Can you talk about mitigation measures put in place to diminish the risk of diversion?
I want to thank my colleague for the question. And as I mentioned previously to Dr. Ellis, we take these concerns very seriously, and which is why we asked officials to further investigate the anecdotal reports that had been made available. And we also wanted to ensure that we took steps that the pilot projects that we are funding have the appropriate and important safeguards and guardrails to control diversion and ensure that those measures were in place. In terms of actions taken, our officials undertook a detailed assessment of the risk mitigation measures that are all federally funded programs that are providing pharmaceutical alternatives are obliged to do. And the outcome of those actions of doing that detailed assessment was that most programs demonstrated very strong approaches and have a range of protocols in place to mitigate diversion. In the instances where further information or improvements are required, we've instructed officials to reach out to those sites and continue to work with them. We're committed to saving lives. Some of the steps that we've taken on these projects and ensuring that they implement the practices that we want to see in place to reduce the risks of diversion included patient screening, matching drugs to patient tolerance, risk-based protocols for assessing patient eligibility for take-home dosing, patient monitoring. Actions also included instances where there may have been diversion that we were concerned about. We took the option to switch the observed dosing prescriptions, transfer the individual to a different set of support services, or in some cases remove them from the program. We want to ensure that this is as safe as possible, and we also understand that, as everyone around this table, that diversion is illegal, and we will continue to maintain safety in our programs.
Thank you very much. And of course, we know there's no one-size-fits-all approach to this. As you mentioned, it's a multifaceted, pervasive epidemic that we're dealing with in Canada. And I am the Parliamentary Secretary to the Minister of Indigenous Services Canada, and so of course I'm going to have a lens here on supports for Indigenous peoples. So I'm just, with regard to supporting local organizations conducting this life-saving work, how do we best support the needs of these individual communities, and in particular in urban settings, Indigenous peoples?
I want to thank you for that very important question. We know that amongst in the overdose crisis, when we look at the numbers, some of the most vulnerable and highest numbers and disproportionate numbers are within our Indigenous communities in terms of risk of overdose and deaths. And that disproportionate impact has to do with, decades upon decades of systemic and institutional racism, colonialism.
Sorry, guys, just going to take a second to say hello to everybody in case I don't want to miss anybody. Rickety, good to see you, man. It's been a bit. Who else? Yolanda, what's up? Good to see you. Jolanda. And LJ, what is going on, my man? Anyway, back to it.
And intergenerational trauma and that lack of access of culturally appropriate substance use services and supports has been something that our government has been committed to addressing. Working with Minister Haidu, as I mentioned in my opening remarks, we're working hand in hand to ensure that mental wellness and substance use supports are in place. We've allocated $650 million in the current cycle to ensure that Indigenous communities, both on reserve and off reserve in urban settings, are getting the services that they need.
Excellent. So I love to hear. Thank you so much. And I am the Member of Parliament for Fredericton, and we are one of the first original 5 sites for the SUAP projects. But we're also struggling with a lot of misinformation in community. Sometimes there's that NIMBYism that happens as well around the safe consumption sites and harm reduction measures. So can you explain why these interventions provide critical supports to those who use drugs and substances?
I'll thank you for the question. When we look at how we're going to tackle the toxic drug supply that is pervasive throughout the country and persistent and so deadly, we have to look at it as what is a full continuum of care in responding to this crisis, so that we're actually meeting people where they're at. And where we meet them is in community. And that's why safe consumption sites are so critical in terms of harm reduction as part of the continuum of care and services. Safe consumption sites open the door for those who use substances to oftentimes have their first encounter with healthcare service providers, with outreach providers, to understand what safety measures they should be considering when they are using drugs, and also to provide them with information, resources, and options for services towards wellness. Without that entry door, these people would be home alone or not even home, somewhere else, in vulnerable situations, exposed to the illegal toxic drug supply, which is the primary driver of the overdose deaths that we're seeing. The safe consumption sites are critical as part of our continuum of care. And reduction, if I may say this very clearly and resolutely in this place, is healthcare. It is a healthcare service, and I think once we wrap our heads around that and adopt that and understand that, we can really push back the tide on the stigmatization and misinformation that we're seeing.
Thank you. I just have a couple of seconds left, I'm sure, but I'd just like to give a shout out to my home community, to the Recovery Center and all the work that they do. I have the good fortune of attending Snacktivist Fridays and hanging out with those folks with that lived experience and learning about how this is improving their lives. They're getting a hold of their mental health. They're seeking meaningful employment and housing options. So that continuum of care is certainly an approach that's working in my community. So thank you so much.
Thank you, Ms. Atwin. Suite, Madame Laroche, pour 6 minutes, s'il vous plaît.
6 minutes, Madame Laroche. Thank you very much, Mr. Chairperson. This issue is far too serious to be politicized. I'm prepared to work today with rigor, just like my colleague whom I'm replacing today has the want to do, the member for Montcalm. Now, I'm very much interested in this issue. As a teenager, I remember meeting an advocacy group that was working on harm reduction when it came to substances, but also from a public health standpoint. And I'm a regional member of Parliament in the Grand Bay area, and we know that this issue is not just in major urban centres. And recently, I got wind of the fact that this is affecting the Grand Bay community and that people are dying. And this is having an impact on life expectancy. We're seeing that life expectancy is dropping across Canada. So I'd like to turn back to the regional aspects of this question. Minister, is there still money that the government is able to invest so that other communities can have access to the programs that are in place? As I said, Mr. Thériault met an advocacy group who work in a far-flung remote area, much more than mine, and they told him that to have access to services, folks had to drive for 2 or 3 hours, and they just didn't have enough money to bring the services to them. So what do you intend to do to help those people out in, not just in the major urban centres, but in remote centres as well? Thank you, Minister.
Merci à mon collègue pour la
Thank you to my colleague for her question.
And it's one that we really do grapple with. One of the important pieces of the SUOP program, of which we just closed a recent funding cycle of proposals. We received 600 proposals from around the country to allocate $144 million. Were accepted from communities far and wide from throughout the country. Quebec is unique in its tranche of SUOP funding, is that it is transferred to the province for its own decisions under its jurisdiction. That being said, through SUOP, we have looked at programs such as the Norse overdose call hotline, which makes it accessible for anyone to call from wherever they are in the country if they are using substances, to be able to be monitored safely while they are using. We will continue to work with communities, including rural and remote communities, as they offer proposals to us for consideration to how best support. The communities know what they need best, and we will continue through that lens.
Oui, et vous l'avez bien dit, Madame.
And you've stated it clearly, Minister, Quebec is unique, and I'll come back to that a bit later. But there's a lot of work in the mental health field that's occurring in Quebec, and I hope that you bring back that work to your colleagues, share it with them. The important work with regards to healthcare transfers. Quebec is working in a unique way to implement its particular projects. Now, in the past, I worked at a community organisation that focused on mediation. And I rubbed shoulders with other community groups at the time. I heard about a similar initiative at the time to do with prevention and education. And I met an organisation that was tasked with broadening awareness about these kinds of things. Now, Health Canada sought to contact 2,000 festival organisers to provide them information about naloxone and provide them prevention material and documentation regarding overdose, both to the participants and organisers of those events. Where are you at in that process, and to what extent have you reached out to those organisers?
I want to thank my colleague for the question, and I will acknowledge Quebec does have some incredible innovations. My counterpart, Minister Carman, has shared with me the work being done in St. Henri on a very innovative project there that has full wraparound services, including a safe consumption site. But you raise a very important point of how valuable the work is that we do with outreach organizations in community. I was recently in Calgary and met with workers there who do exactly that. They are in touch with festival organizers, rave organizers, other cultural events to ensure that there is a wide range of harm reduction resources available to participants, whether it's ranging from condoms to harm reduction tools that they would need, including drug checking strips and so on and so forth. And this is work that we, through SUOP, that we are able to support and fund so that our very dedicated and committed and compassionate outreach workers around this country who work in community really understand where they are, where they need to meet those who are using drugs, where they're at, so that they can provide that first entry point for creating safety and also upstream prevention and education. So SUOP is an amazing tool that we continue to support and use, and I'm excited to see the new round of proposals and programs as they roll out this year.
Madame LaRouche. Next, Mr. Johns, please, for 6 minutes.
And thank you, Minister, for being here, and especially to your team and all the people on the front lines of this crisis. Minister, you read the article, I'm sure, in the Globe and Mail. It was a new research report that was released to the public, and it cited that British Columbians who were at risk of death related to illicit opioid use were 61% less likely to die from any cause in the following week if prescribed at least 1 day's supply of a pharmaceutical alternative. According to this research, it also stated that if they received 4 or more days of safer supply in 1 week, the rate of any cause of death was lowered by 91% in the next week, and death from overdose was reduced by 89%. Now, in British Columbia, there is 4,265 people on a safer supply pharmaceutical drug alternative. That's only 1.8% of the 225,000 daily users of illicit substances, that toxic drugs, that the other 98.2% are relying on the organized crime and the street toxic drug supply to meet their needs. Minister, looking at that, the scientific evidence demonstrates that the life-saving impacts of safer supply clearly is critical, and I'm concerned that your policies have been, created based on not on evidence, but because if you went on the evidence, you wouldn't take an incremental approach. You'd be scaling things up. And I'm concerned about the fear-mongering that's coming from Conservatives, and also the hesitancy to extend funding for the 21 safer supply programs that are providing effective care right now to thousands of people. Because, my understanding is if, prescribing data, that cutting the funding to these programs is dooming about 30% of federally funded safer supply program clients to their death within 6 months of ending those programs. So I guess I'm looking for you. Minister, what will you say to those families in 6 months if SUOP funding for safer supply programs is not renewed?
I want to thank my colleague for the question, and I always appreciate that you are such a strong advocate not only for your community but in tackling collaboratively the overdose crisis and the illicit toxic drug supply that is impacting so many of our families and communities. There are 24 safer supply programs in the SUOP at this moment in time. As I mentioned in my earlier comments, officials have been doing extensive reviews to ensure that diversion mitigation measures are in place. The new funding round of proposals has been accepted and is under review, and announcements will be coming soon for the programs that applied for, and amongst those, if they applied for renewed support, they will be available. They will be considered under that proposal program.
Minister, these people's lives are at risk. This is real. And Minister, I want to state a few things here, because this shouldn't be, and we're hearing the conversation here at this table, that it shouldn't be about recovery versus harm reduction. And, you know, there are mountains of evidence on the effectiveness of harm reduction programs like supervised consumption services and now safer supply. Will the Liberal government create policies based on evidence, or will they do it on reaction to the fear-mongering that's coming from this side? Let's look at the evidence of what happens when fear-mongering shuts down harm reduction programs. And I'm going to go back to the Conservatives, because it shouldn't be recovery versus harm reduction. We need both. In Alberta, banning of safer supply, closure of supervised consumption services, and adoption of a recovery model that lacks evidence and regulation has led to an 18% increase in drug toxicity deaths this year over 2022. In Saskatchewan, where harm reduction has been abandoned in favor of a recovery model, deaths in 2023 increased by 32% over 2022. Saskatchewan also has the highest rate of HIV in Canada, 19 per 100,000. In Ontario and BC, where there are relatively robust harm reduction programs, deaths are also increasing due to the unregulated fentanyl supply, but at significantly lower rates. BC deaths are up 5%, Ontario 6.8%, again compared to 18% in Alberta and 32% in Saskatchewan. Any increase in deaths is not acceptable to anyone at this table. It's a policy failure and morally reprehensible. But the Conservative anti-harm reduction and anti-safe supply disinformation campaign is most active in the provinces with the highest death rates. Minister, the data is clear, yet your government is stalling on providing SUAP funding for safer supply programs. Are your government policies on this issue based on evidence or opinion polling that is influenced by the false narrative of the Conservatives?
Chair, how much time do I have to answer?
A minute and 15 seconds.
Okay, so I agree with my colleague wholeheartedly. In addressing the overdose crisis, there is no either or. It's not a harm reduction or treatment. It's not safe for supply or recovery. As I've said, and I will repeat again, we need a full continuum of care and healthcare interventions and services to help those who are most vulnerable and struggling with substance use. With regards to your question, Mr. Johns, we've contacted all of our programs on safer supply that are expiring, and it is my full intention to have our department review and renew those programs with proper mitigation measures in place with regards to concerns that have been raised on diversion. We do know there is evidence. We are collecting data. We are collecting evidence through CRISM, through these. That is exactly why SUAP exists, so that we have evidence to show if these measures are working. We know that those who are on safer supply programs begin a process of stabilization. They begin to make better health choices for themselves. It reduces criminal activity. It reduces someone going on the street to look for other alternatives to pay for illicit drugs that can cause them harm. We have to meet people where they are at in the moment when they reach out for help. That is why safer supply is such an important piece of the puzzle. And when we go to save lives, we cannot do an either or. We cannot stigmatize people when they actually step up and ask for help, to turn them away and say, no, it's either this or nothing. They will die of overdose if we do not meet them where they are at. And I say this as the Minister of Mental Health and Addictions, that it is my sole focus to save lives.
Thank you, Minister. Ms. Goodridge, please, for 5 minutes.
Thank you, Mr. Chair. Minister, you're a mom. I'm a mom. And recently in BC, protocols have been put in place to allow so-called safe supply of fentanyl to kids under 18 without parental consent or knowledge. My question is simple. Have you met with the Prime Minister to put a stop to this?
I think the more important question is to meet with the experts who are involved in the prescriber intervention models that you discussed, because they are truly the experts in this field, which is something that we have done. And like yourself, I am a mother.
Have you met with the Prime Minister, yes or no?
I meet with the Prime Minister regularly.
Have you met with the Prime Minister to discuss fentanyl to children under 18 and putting an end to it, yes or no?
The question should be asked is meeting with experts and physicians who are responsible for prescriber models to their patients. Medical practitioners
with children under 18 getting fentanyl
The question was
prescribed?
whether or not I met with the Prime Minister. That was not, the question was not
Then
whether or not.
Are you okay with children under 18 being prescribed fentanyl, yes or no?
I am comfortable with medical practitioners meeting with their patients.
Okay,
to
thank you, Minister.
Understand what is best
So
for their patients.
on September 26th in question period, you said decriminalization was the first step. What's the second step?
Harm reduction. There is prevention, there is harm reduction.
Okay,
There
thank
is
you.
treatment and recovery.
So have you had any conversations about legalizing drugs like heroin, cocaine, and meth?
The decriminalization program is not about legalizing illicit drugs. The decriminalization program pilot project that was requested by the BC government is about reducing stigma, those who are in personal possession, to be able to access medical
Okay, thank
services
you.
and interventions.
So what is your stance on publicly traded companies like Safe Supply Streaming Company and Lucy Scientific who are selling stock based on what they seem to predict as a legal market in Canada for drugs like heroin, cocaine, and meth?
I don't work in hypotheticals. I work in the realities of this moment.
This
and
is
the
the reality.
realities of this moment are that the interventions that we work with the BC government and with many jurisdictions across the country on based on prescriber-based interventions. If the market
Minister?
wishes to speculate, that is the market's choice.
Minister.
We are fully committed to
Please.
a prescriber model.
Go ahead, Ms. Goodrich.
So are you committed to no more legalization of hard drugs in
We have
Canada?
not legalized hard drugs.
Will you? You have. You legalized marijuana since forming government in the last 8 years. My question becomes: are you looking to legalize more drugs? Yes or no?
We have not legalized illicit drugs.
Okay. So, Minister, I know we've had conversations.
Chair, do I have another moment to answer on that?
No.
No. Okay. Thank you.
Go ahead, Ms. Goodrich.
What my colleague was trying to show earlier with the fact that a few grams could kill somebody with fentanyl, and yet you've allowed a decriminalization pilot project to allow up to 2.5 grams, which most Canadians aren't familiar with grams because we don't do our baking or our measuring in grams. It's a lot. It's a lot more than a couple grams, and so it's terrifying that we are allowing people to just have free will on this.
What's up,
When I
Wolfhound?
asked your
Good to see ya.
predecessor at committee, what would it take to stop the decriminalization
Kristen
pilot
Miller?
project, this experiment on our society? She said very clearly, both on the public health indicators and the public safety indicators, what we're seeing is out of control crime and chaos on our streets and increase in overdose deaths. And yet you very clearly said that you are A-OK continuing on with this decriminalization pilot project. Is there anything that could happen that would make you stop?
Okay, now, Minister, you have a full minute without being interrupted. Go ahead.
Thank you, Chair. So I'll start by saying the 3-year pilot exemption that was asked for by the BC government was put forward after extensive consultation, including of the amount of 2.5 cumulative threshold. And I would note that not while it was approved by Health Canada, it was supported in full by the Canadian Association of Chiefs of Police. So this wasn't done without consultation. It wasn't done without careful consideration.
Hello,
But I would
Sheila
also note
Hall.
the
Good to see
composition
ya.
of the drug
How are
supply
you?
at this time is changing. It's deadly, and the substances that are in it are frequently unknown even to those who use them. So to posit that it's specifically one drug and that 2.5 is really not facing the reality of what's on the streets that is so deadly to those who are using them.
Thank you, Minister, and thank you, Ms. Goodrich. Next, we're going to go to Dr. Hanley, please, for 5 minutes.
Thank you very much. And before I forget, I will cede my last 90 seconds with your assistance, Chair, to my colleague, Mr. Morris. Minister, thank you for being here, and thank you, officials, a distinguished panel of officials for being here, and thanks for all the work that you're doing. I just wanted to note a couple of things. First, the Yukon coroner just announced last week 23 Yukon deaths in 2023. And although that might sound like a fairly small number, that's in the rate of 50 to 51 deaths per 100,000. Again, showing how this is affecting smaller regions and jurisdictions in Canada just as much as anywhere else. The toll weighing very heavily on First Nations communities as well. Briefly on the on my colleague Dr. Ellis's use of the word experiment, I just wanted to say that really the reason for putting the word experiment is trying something new, and that is when if we are trying old stuff and doing the same thing over and over again, I think someone much smarter than me called that the definition of insanity. And so an experiment is really determining the efficacy or likelihood of something previously untried, and I think that is the idea behind new models such as decriminalization in BC linked with safe supply, harm reduction, and the other pillars of care. If there is a failed experiment, surely it's prohibition. I am not sure of a single example where prohibition has actually worked. I would also say that if we go to a purely recovery-based model and discourage the other pillars, as some jurisdictions are trying, then we are getting towards approaches that are based solely on values rather than public health evidence. So. But in view of my time, Minister SAKS, I do want to give you a chance to answer a question, and this is around the new substance use strategy that was published, along with the funding, I think $359 million in budget 2023. I want to know a little bit, perhaps in a minute or less, your discussions with provinces and territories and how you see building consensus towards approaches that make the best use of this money, $359 million over 5 years, and the controlled substance strategy.
I want to thank my colleague for the question, and the renewed CDSS is really about what the Canada model truly is, of ensuring that we have a full continuum of care that recognizes the social determinants of health and also the social determinants of vulnerabilities that result in individuals becoming substance users, which is why the CDSS will be working with 15 different departments. Excuse me. My apologies. 15 different departments, including housing, including Indigenous services and others, to ensure that we are looking at all of the pieces of the puzzle, including enforcement, so that when someone seeks help through the healthcare system, they are fully supported. And that's the vision that we have.
I'm sorry, I'm going to have to cut you off there to defer to my colleague to continue, also to allow you to catch your breath.
Mr. Morris, please. Thank you, Mr. Hanley. Minister, thank you again for making clear today that safe supply saves lives. A father in my community, Dale, recently wrote me about his daughter, Kayla, who very sadly died from an overdose death from poison drugs last April. From his letter, quote, "Had Kayla had access to a safe supply, she would very likely be alive today." I'd like to share this letter with you, Minister, and as you know, this is not an anecdote. It's what 130 experts in substance use wrote to you about in December, noting the 15 peer-reviewed research studies and 5 program evaluations that back this up, as documented by the Ontario Drug Policy Research Network. This is the reality of the peer-reviewed research we have. I appreciate what you've shared already this morning at a time when safe supply contracts that are currently in place, including with Sanguine Health in my community, are set to expire in March. Can you confirm that Health Canada officials will not be swayed by any disinformation on safe supply and will continue, and if not increase, funding to safe supply through the Substance Use and Addictions program?
A brief answer, please, Minister. We're out of time.
We are fully committed to a full suite of resources and tools to help those who struggle with substance use. safer supply is one of those tools, and we will continue an evidence-based approach that is compassionate and meets people where they are to get them the help that they need.
Thank you. Madame Laroche, s'il vous plaît, pour 2 minutes.
2.5 minutes, Ms. Laroche. Thank you, Mr. Chairperson. Minister, in Quebec, there was a face to this opioid epidemic at the start of the year. Mathis Boivin, 15 years of age. All my respect for this 15-year-old young person who has sent out a media message to the media. Let's do away with taboos, stigmatization, and that has come about through the forceful message that he's sent out so that parents and children can discuss these issues. So my condolences to Mathis Boivin's family. Minister, turning to another subject, you talked about Mr. Cadman and his program in Quebec. And one of the previous times that you discussed the issue with my colleague Luc Thériault, you said that Quebec had an excellent program to combat mental health issues. Mental health has to do, of course, with substance use and abuse. What are you waiting for to transfer to Quebec the money it needs so that it could put these things into practice out in the field?
With regards to the $200 billion that the federal government has committed to with provinces and territories in bilateral agreements, we are moving through the process of securing those agreements. Some have signed. Quebec is still in negotiations. $25 billion of that money is also dedicated specifically when it comes to mental health and substance use resources. I am confident that Quebec, like all other provinces and territories, will conclude their agreements with us to ensure that the good work that they do continues.
Well, what would really help, and what Quebec is calling for, is an increase to the health transfers in a meaningful way. So we're talking about an increase in the ballpark of 35%, but we can come back to that at a later stage. Now, to combat the import of illicit drugs, border measures need to be tightened. The last time you appeared, you talked about a targeted approach for opioids. Is that going to be on a data-based approach? And what are your thoughts in respect of that?
That is a question that we are working with directly with Public Safety Minister LeBlanc. Some of our conversations to date have also focused on the impact of precursors coming into Canada. This was part of my discussions actually when I was in Washington in November with my counterpart there as well, and has been raised in other forums. We are part of a number of collaborative groups. I think Jen SAKS can speak to this in more detail of the collaborative work that we're doing cross-border with the United States to address enforcement and border measures. Jen?
Sorry, Ms. Sachs. We're going to go to Mr. Johns. I know that you're going to be with us in the second hour, and I expect you'll get a chance to expand on it then. Mr. Johns for 2.5 minutes, please.
My colleague just talked about mental health, and you cited the commitment of $25 billion over 10 years, $2.5 billion years, but you didn't talk about the fact that it's over 4 priority areas. So I did the math, and you're falling short on your commitment of $4.5 billion over 5 years to deliver mental health by $1.375 billion. I've talked to you about this, about creating a direct fund to make up for that gap, given that we're in a crisis when it comes to mental health and for post-COVID recovery. Are you considering looking at what I've talked to you about and delivering something in this budget?
As I've mentioned previously, we've made a commitment with provinces and territories of $200 billion over 10 years, of which mental health and substance use is one of the key pillar priorities. We know that as I said in my opening remarks, mental health services and substance use services really need to be part of universal healthcare systems in each of their jurisdictions. This is what we're moving towards in these bilateral agreements. We don't have all of them in place yet. In weighing out considerations of additional funding, we are encouraged by what we've seen so far in the proposals of the agreements that we've seen, of the investments that provinces and territories are making. And as I mentioned, also meeting quarterly with my counterparts, we are pushing them to make those commitments with the budgets that they're receiving.
We're hoping that you're going to increase it. Minister, Sachat Nation in my riding hosted the Alberta Valley Toxic Poison Drug Strategy yesterday, calling for a whole-of-government approach is what you talked about. They need you at the table for resources in your government to do that in an urgent way. We talked about Portugal scaling up on safer supply from 250 people to 35,000 in 2 years. They engaged the military. You still have not delivered a plan with a timeline to show that you're demonstrating an emergency. Now, Minister, I want to introduce you to Teresa. Teresa is a 32-year-old Indigenous woman who has stabilized her substance use on Safe Supply. If SUIP funding for Safe Supply ends in 2 months, she doesn't know, if the new life she has built will be ripped apart. And I guess, Minister, could you look at Teresa in the eye and tell her that funding is ending, so she will have to go back to sex work, back to unregulated street fentanyl, back to chaos, back to violence, back to criminality? Or, Minister, might Teresa be one of the 3 out of 10 Safe Supply clients who will be dead in 6 months? Are you going to commit to extending that funding?
What's up, Jim?
I've
How are
already
you?
said in my comments to Mr. Morris and you that
The
we are
existing
committed to
projects,
funding.
are you going to extend that funding?
We've contacted all of the existing programs that are expiring, and it's my intention to renew those that have proper mitigation
So
measures.
Teresa can count on you.
Canadians can count on the federal government to ensuring that we put every resource and tool available to save lives of those who use substances.
Thank you, Mr. Johns. Thank you, Minister Sachs. Next, Dr. Ellis, please, for 5 minutes.
Well, thank you, Chair. Minister, it's pretty clear what we've heard. You're okay giving fentanyl to kids without parental consent, and you will not rule out the legalization of other drugs like cocaine. Have you read this study from the British Medical Journal talking about mitigation guidance on opioid and stimulant dispensations? Just came out in January.
No, I have not read it.
Right. It's interesting because my colleague, Mr. Johns, referenced it, and clearly he presented the biased option, which sadly misuses the study and doesn't talk about the opioid agonist therapy, which exists inside the study but is not talked about inside the study. We're firm believers on this side of the House that opioid agonist therapy and rehabilitation is the way to go. What we're having a trouble with, and what you've clearly failed to see, is the difficulties associated with your so-called safe supply that is actually harming people. So the question is when will you read this study, and when will you take actual science and the criticisms of this paper into account when you're making your policies?
Mr. Chair, we do have an expert in the room here on research and evidence and peer-reviewed reports, so I'm going to turn it to Dr. Sam Weiss, if I may, to answer Dr. Ellis.
Thank you very much. The study that has been referred to from the British Medical Journal, published in January, was funded by the Canadian Institutes of Health Research, and we're very proud of the important work. Excuse
me, sir. I realize that I asked the minister the question, but get to your point. I guess the question is, I don't care who did it. Have you read it? And do you know the criticisms of that paper?
Yes, I have. And I know
and when
that
are you going to take into account the criticisms for that paper when you're creating your policy on your so-called safer supply?
Right, so I don't create policy. I'm a researcher. But
thank you very much. I don't need an answer from you then. That's very good, because the person who's signing off on the policy isn't reading the paper and clearly is not getting good advice. So I'll turn the time over to my colleague, Ms. Goodridge.
Thank you. What is your stance, and do you believe that drug users should be able to use drugs in children's playgrounds?
We signed an exemption at the request of the BC government, an amendment, my apologies, in September with regards to playgrounds.
So you don't think that drug users should be allowed to use drugs in children's playgrounds?
I believe that in addressing the opioid crisis and the overdose, the level of overdoses that we're seeing, that we need to have a clear anchor both in public health and public safety.
I'm asking a really simple question. So yes or no, should drug users be allowed to use drugs in a children's playground?
We signed an amendment at the request of the BC government in terms of demarking public use with regards to playgrounds, splash pads, and other public areas.
Do you believe that recovery from addiction is possible?
I think that everyone's journey is unique and that recovery is possible for those, but it often, in many cases, the evidence shows that it takes more than one try.
Do you believe that we should have a recovery-oriented system of care in place in Canada?
I believe we need a full suite of services and a continuum of care that includes prevention, harm reduction, treatment.
Do you think it should be easier for people that struggle with addiction to access treatment than drugs?
I think that an individual who struggles with substance use should have the lowest access barriers to get help and medical services.
So do you believe that people that struggle with addiction should have easier access to treatment and supports that help them get to treatment than drugs?
That they should have the lowest barrier access to all medical services and supports that can help them with their substance use towards recovery.
Do you believe that we should start restricting the amount of drugs available on the streets so as to reduce the number of new addictions?
That would be with regards to enforcement on the illegal toxic drug supply. Is that what you're referencing?
Well, I'm wondering because what we have been seeing is so many stories coming out about diversion. There are facts and stats coming out about drugs being diverted from safe supply programs getting into the hands of kids. So I'm wondering if you think that we should be far more strict. If you're going to continue allowing drugs to just be flooded into the streets, do you think there should be witness programs? Do you think that there should be spaces so that they cannot just carry those with them and potentially sell them to kids at playgrounds?
In my answers to Ms. Atwin earlier, so they are on the record, we talked about the extensive mitigation steps that we have taken with those safer supply programs to ensure diversion is mitigated as much as possible. As I said, diversion is illegal in this country and continues to be so.
It's still happening. Drug use is illegal. It's still happening.
It is.
And so my questions are very pertinent. And frankly, I don't want to see
How are you?
So-called safe supply at kids' playgrounds. That should never happen, and yet we see it. We see it day and day and day.
Anecdotal evidence.
Sorry, that's your time, Ms. Goodrich. Go ahead and finish your answer,
You've referred
Minister.
to anecdotal evidence. What we have done is taken rigorous mitigation measures with safer supply programs, but in addition... Am I at time, Chair?
Finish your thought, please.
What's up, Bagels? How you doing?
What I will say is that when the exemption was put into place at the request of the BC government, BC chiefs of police at that time said that they had every tool available to them and resource to ensure public safety in public spaces. It was at the request of the BC government in September that we signed off on additional amendments, again, at their request. We continue to work collaboratively and comprehensively and assess and monitor the exemption. Thank you.
Thank you, Minister. And the last round of questions for the Minister will come from Ms. Sido, please, for 5 minutes.
Thank you, Mr. Chair. Thank you, Minister and official joining us today. In April 2019, this committee traveled across the country to witness firsthand the impacts of the rise of problematic methamphetamine use, that it was an eye-opening study for all of us. Back then, what we see, stigma associated with the substance use and addiction was identified. That was a significant issue we have to address. Can you, Minister, talk about that to the committee, the work you are doing and your department are doing to combat stigma?
So there's a full suite of tools that we need both in the prevention space and in the harm reduction space to address stigma. And it starts by really creating spaces within communities to meet people where they're at. And that is why programs like SUOP provide such comprehensive outreach programs. And the workers there are incredible. The work that they do day in and day out is compassionate, it is caring. It's also anchored in evidence of what works best to meet those who are most vulnerable in their needs, to get them to medical care and assistance. But that is just one piece of the puzzle. There is prevention work that we're doing, particularly when it comes to youth. Our integrated youth service support has been so significant in understanding how our young people in communities at vulnerable stages of life really also need interventions that are community supported so that they are protected and supported in a world where the toxic drug supply is so pervasive. Dr. Weiss can speak to some of the early evidence of the integrated youth service of how it's how it is working and how it's being implemented, but we've also committed $20 million towards the Icelandic model that will be rolled out this year to meet youth and also reduce stigma. Dr. Weiss?
Sorry. Right, so thank you. The Integrated Youth Services model, which is now active in 9 out of our 13 provinces and territories and in 8 Indigenous communities, seeks to provide a community-based program for individuals to receive mental health and substance use care, as well as all related services that can allow them to have the best chance for a trajectory, a healthy trajectory, includes sexual reproductive services, housing services, and the like. And it operates under a model called measurement-based care, which means that every individual who is seen,
Elizabeth, how are you?
Walk-in, no appointment, no referral required, has their services, and they participate directly in measuring the actual outcomes. And this is a transformational moment because we hope to see this level of service available, including at a virtual level as well for those in outlying regions where the kinds of services needed at the most vulnerable period of time when young people are at highest risk for developing substance use disorders as well as chronic mental illnesses is made available. And what's remarkable is that it's working from the grassroots up. We have municipalities, communities, provinces, and the federal government all working together because community health is the future, and that's why we're very enthusiastic about it. If you complement it with what is hopefully to be adopted, the Planet Youth model from Iceland, which seeks to have communities come together to ensure that young people are not diverted away from healthy activities to unhealthy activities, you start to focus on the upstream issues that really lead ultimately to addiction and chronic mental illnesses. And as part of our strategy, I think as a country, we have to recognize that youth are the most vulnerable, and if we're able to provide them with the resources needed where they're at, there's a greater likelihood that we'll stem the tide of individuals susceptible to the increasing toxic illicit drug supply.
Thank you. Minister, I came across an interesting study from the University of Alberta from last year that studied the public opinion in Alberta and Saskatchewan for safer supply programs. The majority of respondents, almost 64% in Alberta and 56% in Saskatchewan, supported safer supply programs that replace illegal street drugs with pharmaceutical alternatives for those unable to stop using. The study suggests that there is no lack of public support towards these measures. Can you share your thoughts with this committee about the diversity of opinions Canadians have towards this issue?
As briefly as you can, Minister, please.
I would say that this is why, in combating stigma, if we go back to your previous question, why we need a full suite of resources and supports that include prevention and harm reduction, including safer supply, because we understand that when you meet someone where they're at in their struggle, at their most vulnerable, when you see them and you get them to safety, that is when we break down the walls of both stigma but also bring people to a better place in their health.
Thank you, Minister. That concludes the first hour. I want to thank you for accepting our invitation to be here with us and for the patient manner in which you took our questions. I know the format is difficult. It's not always easy to give a very short answer to a very short question, but you've handled it well, and we certainly appreciate you being here. Appreciate the work that you do and the passion that you bring to the work that you do.
One dirty hand washes the other. It's crazy.
We're going to suspend to allow the minister to take her leave, and then we're going to continue on with officials in about 5 minutes. We're suspended.
All right, gang, we are going to wrap it up. That's about all we can handle of Yahar SAKS. SAK is something. Anyhow, gang, it's fun to get together again. We will be here on a daily basis. We'll come up with a proper schedule. If you have somebody that's interested in Canadian federal politics, share this with them. We've got a great community. It's fun to see everybody again. Couple of new faces, but a lot of familiar names. I love that stuff. Anyways, we're back, guys. Canadian Looney, I'm Aaron. Like, subscribe, share, get notified, all those fun things. And yeah, we've got a couple of weeks before they're sitting in Parliament again. I think that's the 17th of September. But we have some interesting committee meetings coming up this week. Some real interest. There's an OGO committee tomorrow. That should be pretty wild. There was a committee today, but I watched it. It was kind of boring, and 95% of it was en français. So not the type of thing that I often would show on here. Anyhow, gang, I'm gonna get going. Thank you all so much for tuning in. I see Tommy Gunn late to the show. What's up, Tommy? Anyway, yeah, we're gonna zip, guys. We'll go out on this. It's always fun.
Oh, hello. Do you have a warrant to be here?
Maybe there's a little grass growing right along here. Some happy little things.
I love you, you love me. We all own our own bodies, so marry who you want and do whatever drugs you choose. And when it's time, you can die with dignity by determining your own end-of-life plan.
Hi, Maria!
Hi, Officer Winkles!
How you doing today?
I don't have to answer that question.
That is correct!
I'm recording you! Am I being detained?
Nope!
Which I can legally do because I'm in a public place! Come back if you have a warrant!
Alrighty!
Know your rights! Yay!
Okay, Gumshoes, Carmen Sandiego is in a country where socialism failed. That narrows it down to Venezuela, Cuba, the former Soviet Union, Moldova, Laos, Vietnam, Albania, Angola. So we did some digging into your past.
Oh, this suspense is killing me! But we still haven't solved the case, Holmes. Why is marijuana a Schedule 1 drug?
Elementary, my dear Watson. Nixon and racism.
What?
You okay? I don't know. Hey man, it's alright. It's alright. We've got qualified immunity. Qualified immunity, it's not for you, it's just for me. I shot your dog. I shot your wife. I get to go on with my life.
My favorite part is where the character says, I do not want green eggs and ham. And then Sam I Am says, that's fine, you don't have to eat them. That's your right. The end. It's a short book.
Here we see one of the last taxicab monopolies struggling for life. Competitors have entered their ecosystem.
Do you know what eminent domain abuse is? It's when the government decides the neighborhood of make-believe is better used by a Taiwanese LCD manufacturer.
Today we have a real senator! Hello, Senator!
How are you doing?
What is your favorite color?
I would have to say blue.
Me too! Tell me, why did you sell all your stock right before the crash?
I mean, it's literally just the tragedy of the commons, but they made it cute.
And that sound means we're in international waters. I'm gonna marry a robot and sell my kidney on eBay.
My dearest Rowena, today the district attorney filed criminal charges against a two-door sedan.
Carmen Sandiego is hiding in a country that contains an American military base. Is she in Australia, Bahrain, Belgium, Brazil, Bulgaria, the British Indian Ocean Territory, Cuba, Germany, Djibouti?
Circle, square, rectangle, war factory.
All right, Jack, where is your gay wedding cake?
I refuse to bake a gay wedding cake, and you can't force me to. It's my right.
That is your right, but it is my right to kick you off of this show. Please leave.
Yep.
You homophobic, bearded meat goblin.
I just want enough to warm it up, son. I don't want to set it on fire. It's very easy to set it on fire.
Well, today on This Old House, we're at the city zoning office because they think our new porch is 2 inches too close to the sidewalk, which is f***ing bullshit because their sidewalk is too far away from the street which they'd know about if they'd read any of the emails I'd sent them over the past 18 months. So join us as we waste our whole f***ing day on the
The premiere of Thomas the High-Speed Rail has been delayed. Again. And at the 10 Bitcoin level, you receive a handsome tote bag.
Quack! Good one! Quiet! Very good! Queen! What else starts with the letter Q?
Space lasers.
Oh!
John Podesta and Hillary Clinton had an email exchange about hot dogs.
Where do we get these puppets?
It's a beautiful day in the neighborhood, and you have a right to defend your house with firearms. With firearms.